Rebuilding Healthcare's Broken Cosmos, Digital Sovereignty, and the Astronaut Paradox with Edward Mertens, President of the IMD Alumni Club Lausanne and Managing Director at IBM Client Innovation Center Switzerland, and Dr. Patrick Schur, Professor in EDSC, founder of the Sea Wind Solutions in California, by alias Kepler.
Today, Dr. Patrick Schur, physician, ETH Zurich collaborator, and architect of a radical system called the Co-Internet. He claims healthcare's data fragmentation is worse than NASA's challenge of monitoring astronauts in space. We'll discuss why hospitals can't share records across the street, but NASA streams vitals from Mars. His $20 million digital medical passport project with ETH Zurich. How disciplined habits like making coffee hold the key to systemic change, and why he's pitching IMD Business School to host a historic panel with Tim Berners-Lee. Patrick, you presented this to IMD's alumni as astronauts in scrubs. Start with the paradox.
1. The astronaut paradox, static systems versus human flow.
Edward, imagine. An astronaut collapses on the ISS. Instantly, Houston knows her blood type, medications, genome. Yet if she collapses in Lausanne, paramedics see nothing. We fax records like it's 1985. This isn't a tech gap, it's a trust architecture failure. My proposal to IMD confronts this. We've built the protocol, BCCCOP, to make data follow you biometrically, not trapped in static screens, not delegated to institutions, owned, flowing like oxygen.
But hospitals argue GDPR, HIPAA, security. How is your system different?
Those laws treat data like a relic in a museum vault. We treat it like a river. Encryption isn't the barrier, it's the gate. Our patents in collaboration with ETH Zurich let patients control access, yes to emergency doctors, no to insurers. This is why I need IMD to gather Berners-Lee, Google Health, EU regulators, and world ethical representatives and rewrite the rules.
The coffee ritual, disciplined habits as systemic blueprint.
You compare healthcare transformation to making coffee.
Absolutely. Think grind beans, boil water, structured steps, but the system adapts to you. Healthcare lacks this disciplined agility. We've piloted co-system nodes in dental clinics. Dentists see kids' vaccine histories instantly. Small wins create viral change. This is where habits meet code. Clinicians need organizational bilingualism, speaking hospital workflows and startup agility. That's the muscle IMD can build.
And the human resistance.
Bureaucracy is a fear-driven immune response. We don't attack it, we bypass it. Like Apollo 13 repurposing spare parts. Our parallel system runs alongside legacy tech. Prove value in emergencies first, then scale.
The IMD Gambit. Why this panel changes everything.
You pitched IMD to host Berners-Lee, Google Health, EU regulators. Why them?
3 reasons, Edward. Neutral ground, Switzerland's legacy of trust. Hybrid minds. IMD attracts CEOs who grasp both AI and human systems. Amplification. This isn't a healthcare panel. It's about sovereign data for all industries. Finance, supply chains, personal AI. The panel demo, Berners-Lee shows a solid pod health vault. I demo BCCCOP integration. Google Health commits to the framework. That's how you shift paradigms. We want personal AI sovereignty and personal data ownership, addressing the paradox of digital capabilities with personal data control and assistance.
The 4th golden sentence, trust as infrastructure.
One phrase haunts your notes. Digital follows you, biometric, addressable, never delegated. Unpack that.
Today's digital world is static. Screens, apps, logins. Ours is ambient. Like gravity. You pass or walk into an emergency. Your allergies appear because you exist there. No passwords, no delegation. 360 degrees 4D trust. This isn't tech. It's rewiring human expectation. And Edward, this requires courage, not code. That's why I end my IMD pitch with static systems create fragile humans. Flowing data heals.
Patrick Schur, physician, system architect, and advocate for a world where data moves like blood through the lens of an ethical digital omni-resource supply chain, essential, invisible, and wholly yours. Listeners, if you're an IMD alum, join his panel. If you build protocols, collaborate at the Sea Wine Solutions. And if you believe healthcare should work better than a 1969 moon landing, share his anthem, Planets in Motion, on planetsinmotion.com.
Visit www.artofdigitalshadow.org. Let's rebuild the cosmos, one disciplined step at a time.